Hey, you guys, it's Dr. Kimberly Gartman, and it's time for 5 Minute Friday. Today, I want to talk to you about something that is very near and dear to my heart, and I think it's very timely for the season of the year that we're in, and it's something called seasonal affective disorder. It's also known as SAD, or the winter blues, or the winter doldrums. And a lot of people struggle with this. I personally have really struggled with this and only realized it in the last few years and was able to do something about it. So usually seasonal affective disorder starts in the fall when the days start to get shorter. We get less exposure to sunlight, and we can start to feel kind of low. We can start to sink. And so the symptoms of seasonal affective disorder are feeling down or depressed more often than not. Having low energy, like you used to be energetic and be able to do things in the evening, and now you just want to lay down. We can lose interest in things that we usually enjoy, just don't want to do anything. We can have trouble concentrating and focusing on things that we normally could. We can have trouble with our sleep. We can have appetite problems, either overeating or just not having any appetite at all. Sometimes we can go to the point of just feeling hopeless or worthless. We can feel guilty or ashamed because our life is good and we have no explanation for why we feel so bad, but we do. So what is it? What causes a seasonal affective disorder even to happen? Well, it's basically a disruption in circadian rhythm. And so most of us, I won't say most, but lots of us, myself included, are very light driven. And so when there's plenty of sunlight, I tend to do just fine. I have lots of energy, I can go, I can do. But when it starts getting dark really early, like when I go to work and it's kind of dark and I get home and it's kind of dark, I just feel myself start to sink and I get really tired. And it's because the lack of sunlight has disrupted my natural body rhythms, my natural circadian rhythm. And there's some natural slowing down in the winter that's okay, but you shouldn't feel down or depressed. The decreased sunlight decreases serotonin levels, and those are the hormones that help control our mood. And so if those are low, then we'll tend to be lower, and that's directly affected by sunlight as well. It also can affect melatonin levels, which is what helps us relax and sleep. And so if that gets disrupted, then our sleep can be disrupted, and that makes it even a more vicious cycle, frankly. So what are the risk factors other than decreased sunlight? Well, if you have a family history, then you're more likely to struggle with seasonal affective disorder or SAD. If you have any kind of history of depression of any kind, you're going to be more likely to experience SAD. If you live far from the equator, so you don't get as much direct sunlight, and so there's an argument for going south, right? But the farther you are from the equator, the more likely you are to experience symptoms of SAD. And then also a little bit higher incidence in women than men. So what can we do about it? Are we just doomed to suffer all winter long? Do we have to go from fall to late spring feeling awful and depressed and down? Well, no. There are things we can do. And one thing that's really exciting is something called light therapy. And basically what that is a 10,000, it's called Lux of light therapy. It's a light box that filters out UV light so you don't get the harmful effects like you would like a tanning bed or something like that. Tanning beds are not the answer. These are safe. You can order them off Amazon. They're actually really inexpensive now, and the recommendation is just to sit in front of it first thing in the morning for 20 to 60 minutes. And so what I do is I just turn it on first thing in the morning when I'm doing my quiet time and just let that light boost me and affect me. You don't stare straight into it or anything. You can read and do other things, but it's the ideal is to sit about 18 inches from it first thing in the morning to help lift that mood and get you some of that, your body receiving some of that natural light or that good light. You can take vitamin D. I recommend that for sure. In the wintertime, we just don't get as much sunlight, and that's our source of vitamin D. There is counseling. I highly recommend that as well. And then also medication. So if you're really struggling and like you've tried the light therapy, you've done some vitamin D, but you're really, really having a hard time, do not suffer. Go see your doctor. There are things that can be done that can help you, and they're really okay. So I hope that this has been helpful to you. I know getting Lux Light for me has been life changing, and I'm so grateful for it. If you have any questions about seasonal affective disorder or anything else, please let me know, and I'll be happy to answer those and have any kind of discussion with you guys. Thanks again for joining in on 5 Minute Friday.